Hi, welcome back to Faces of Parkinson's. I'm your host, Robert Cochran, and today I'm joined by Dr. Zoltan Mari. Dr. Mari, how are you?
I'm good. Thanks for asking.
Absolutely. Now, Dr. Mari, you're joining us from the Lou Ruvo Brain Center, and we thank you so much for all the work you do down here. Tell me, why is your work at the Lou Ruvo Center so important? Why Las Vegas for you as opposed to the many other clinics you could work at?
Thank you. It's good. It's a good question. So before I came to Las Vegas, I was the director of the Parkinsons and Movement Disorder Center at Johns Hopkins University, and I have helped build that group, and I did quite a bit of clinical research and translational research there as well, and built up a program on deep brain stimulation and other clinical research programs. So for my move, I received a very nice invitation from Mr. Ruvo, as well as from Hubert Fernandez, who is the head of the CNR, the Center for Neurological Restoration at Main Campus, Ohio, Cleveland Clinic. And they told me that there was a wonderful opportunity here at the Lou Ruvo Center for Brain Health in Las Vegas. And with the endowment and the support, I was invited to come here and build a research program as well as further develop our clinical program in Parkinson's disease.
Wonderful. Well, we're very happy to have you here. We've seen a lot of development there at the Lou Ruvo Center. And go ahead and let's dive into some of the most interesting research that you're seeing just recently. We were talking off air about that. But go ahead and lead in. What are you excited about? You mentioned the biomarkers, right?
Yeah, so in my career, I have done quite a bit of work in biomarker discovery and translational research.
And what is a biomarker,
Increasingly,
Sorry, what is a biomarker for those who don't know?
absolutely. So biomarkers are referred as a term, are referring to some kind of biological property, some measurable biological parameter of the body that we can actually reproducibly and reliably measure. Now, why do we want to measure? Well, we measure all the time. We need to know if a medication works or it doesn't. If it works, how much it works. We need to know what disease we are dealing with. We need to diagnose diseases. We need to know how far the disease, in the disease some patients are, or the staging. All of these difficult questions are helped by appropriate biomarkers. So, for instance, there are biomarkers which are diagnostic biomarkers. These are biomarkers that we use to make sure we diagnose a disease properly and accurately, and we can distinguish them from other diseases. So those are the diagnostic biomarkers. Then there are so-called prognostic biomarkers, which is of particular interest to me in Parkinson's disease. These progression biomarkers aim to determine the rate of progression or the severity of the disease. It is very important for us to determine that. The current tools are quite crude and inaccurate, so some more accurate prognostic biomarkers are needed. Finally, there are biomarkers that can help us determine if a particular treatment is effective and help us measure this. So there are many different biomarkers that we can use for these purposes, including imaging, when we do a particular scan of the brain, and these scans can help us determine how far ahead in the disease a person is, or whether some medications or other interventions worked or not. And it can also help us tell Parkinson's disease from mimickers, lookalikes, other diseases. And there are all sorts of biospecimen as biomarkers. So we take a sample from the blood or the spinal fluid, and we look for certain molecules, certain chemicals, certain peptides and hormones and other chemicals that we can measure, analyze, quantify, and these also can serve as biomarkers. It's very important because in order for us to conduct good research, we need to make sure that we enroll patients in our research studies who are certain to have the diagnosis that we are studying. Let it be Parkinson's disease or one of those Parkinson plus syndromes. It's critical for us to be able to be certain that those participants and research subjects we are enrolling, in fact, have that disease and not something similar. So it is also critical for us to make sure that we can study interventions and experimental treatments. If our metrics, our measurements are not very accurate for determining if something works better than placebo or not, then it would require a large trial, which is very costly, and it will also take a long time to follow, and nobody wants to wait years for one of these new drugs to be proven effective or ineffective. We want to have these answers as soon as possible.